Japanese. Spelled F-U.
Hey there, my name is Miza, and I am a pharmacy student from University Brunei Darussalam. Do you think that you have diabetes? According to the World Health Organization, diabetes mellitus is defined as a metabolic disorder characterized by elevated levels of blood glucose. Over time, it may lead to damage to the heart, eyes, kidneys, and nerves. Diabetes can be diagnosed by measuring fasting plasma glucose and 2-hour oral glucose tolerance test. In Brunei Darussalam, fasting plasma glucose is routinely used to screen for diabetes in primary health centers. The blood results can be categorized into diabetic, impaired fasting glucose, and normal glucose levels. Those with fasting plasma glucose of 7.0 millimole per liter and above are categorized as diabetics, and those with fasting plasma glucose between 6.1 to 6.9 millimole per liter are said to have impaired fasting glucose. Meanwhile, those with plasma glucose levels of less than 6.1 millimole per liter have normal blood glucose levels. Patients who are having impaired fasting glucose are required to undergo 2-hour oral glucose tolerance tests and are confirmed to have diabetes if their results are higher than 11 millimole per liter. According to the Brunei Darussalam National Health and Nutrition Status Survey 2009 to 2011, 12.4% of the country's population had diabetes. Prevalence of diabetes was seen to increase with age as shown in the figure on the left. In 2017, diabetes mellitus was the third leading cause of death in the country with a total of 10.1% of the total death. This means that for every 100,000 population, 40.6 people die from diabetes. How does a person develop diabetes? When a person consumes food, the body breaks down the food particles into simple molecules such as glucose, amino acid, and fatty acids, which are then absorbed through the digestive tract and used by the body. Glucose are simple sugars which are transported into body cells such as muscle and fat cells to be used as energy. This process is enabled by the presence of the hormone insulin. Insulin is a hormone synthesized by the beta cells of the pancreas. This hormone is released when there is an elevated level of blood glucose as well as rising blood levels of amino acids and fatty acids. This usually happens after a meal. Insulin acts as the key to open the door to cells to induce glucose intake. In type 2 diabetes mellitus, blood glucose remains high after a meal because glucose is not able to enter tissue cells due to pancreatic beta cells not properly producing insulin, leading to the deficiency of the hormone. The body cells also does not respond to insulin, therefore they are insulin resistant. How beta cell dysfunction happens? When too much food is consumed, there is an excess of free fatty acids and glucose in the blood. Continuous accumulation of these particles induces metabolic and oxidative stress, which damages the beta cells. This causes poor insulin regulation.
Hey glucose, my name is insulin. I'm gonna escort you to the muscle cells. Please go through this door to enter the muscle cells. Oh no! There's so many glucose!
Uncontrolled diabetes may lead to certain complications such as renal failure, blindness, heart diseases, and chronic ulcers in the foot. When a person is diagnosed with diabetes, it is important to do self-monitoring to improve diabetic control. Self-monitoring is an important component of modern therapy for diabetes. It is recommended for people with diabetes to achieve a specific level of glycemic control to slow the progression of complications, as well as to prevent hypoglycemia or blood glucose, which can arise from taking anti-diabetic medications. Ideally, self-monitoring should be reliable, convenient, safe, and easy to use. This can be done by using a glucometer, or more commonly known as a blood glucose monitor. To use this machine, there are several components that are required: the blood glucose monitor, lancing device, lancet needles, glucose reagent strips, and alcohol swab. The first step is to prepare the lancet. Insert the needle into the lancing device, twist the cap 3 times, and pull carefully. Next, set the strength of the lancet to the desired strength. Pull the reset handle until you hear a click. Set the lancing device aside and prepare the glucose reagent strip. Take one glucose reagent strip and insert into the blood glucose monitor machine. Next is to prepare the finger that you will be pricking. Wipe the tip of the finger with an alcohol swab and wait for it to dry. Once it is dry, place the tip of the lancing device onto the finger and press the release button. Slightly massage the finger to get a blood drop. Touch the tip of the reagent strip onto the blood drop. Press the punctured finger with a tissue to stop the bleeding. If done correctly, the machine will beep and the blood sugar level will be displayed on the machine. Record the results in a logbook. Once finished, dispose the used lancet needle and used reagent strip. Store the blood glucose monitor and lancing device for next use. How can patients utilize this machine? Blood sugar testing can provide useful information for diabetes management, such as how the anti-diabetic medication affect blood glucose, track progress in reaching treatment goals, understanding how diet and physical activity can affect blood sugar level. This will enable making necessary lifestyle changes. Before doing self-monitoring, it is important to know your target range. The American Diabetes Association generally recommends blood sugar levels of 4.4 millimole per liter to 7.2 millimole per liter before meals and less than 10.0 millimole per liter 2 hours after meal. For type 2 diabetes mellitus, the frequency of blood sugar testing depends on the medication given. Those taking insulin may be recommended to do blood sugar testing several times per day. If diabetes is managed with oral anti-diabetic non-insulin medication, blood sugar testing can be done once a week. Testing is usually recommended before meals or at bedtime. Alright, let's do some recap before we finish this video. I will be presenting 3 true or false questions. Try to answer them within 3 seconds. Question number 1. Diabetes mellitus type 2 is caused by dysfunction of beta cells. The answer is true, and if you remember, this dysfunction is caused by metabolic and oxidative stress resulting from high levels of free fatty acid and glucose in the blood. Therefore, this can be prevented by practicing a balanced diet. Overeating can become a problem and may lead to the development of diabetes. Question number 2. Fasting blood glucose should be between 6.1 to 6.9 millimole per liter. The answer is false. Those with fasting plasma glucose of 6.1 to 6.9 millimole per liter are said to have impaired fasting glucose and are required to undergo 2-hour oral glucose tolerance test to confirm whether they have diabetes or not. Normal blood glucose levels is less than 6.1 but not lower than 3.0 millimole per liter. Question number 3. Self-monitoring helps with managing diabetes. The answer is true. Monitoring your blood glucose can help you become aware of your health condition and enable you to make necessary changes to your lifestyle. Putting a target for yourself will help motivate you to change your lifestyle by adapting a healthy, balanced diet and increase physical activity to ultimately reach your targeted glucose level. We have reached the end of this video. I hope this video helped you understand what diabetes is and how self-monitoring blood sugar at home can help with management of diabetes. See you all next time!